Children with medical complexity, it is a subset of children with special health care needs. It's children who require medical devices, advanced medical therapies, advanced medications. They often have diseases that impact multiple body systems. Children who have a lot of medical challenges that come with their emergencies. A lot of times it comes in like any other 911 call. The tones drop, you get sent in your ambulance to go to a house. Sometimes you might get a little bit of heads up in the dispatch information of like, hey, you're responding to a pediatric call, and hey, there's medical devices, or some part of the story might give you a few clues, but if you haven't been trained in even how to pick up on those clues, it still might be a surprise when you get there, and you'll arrive sometimes a living room that looks like an ICU, or you're going to encounter a kiddo who has a lot more challenges that you're not prepared for. And EMS has always done the best they can, but sometimes you're really starting behind the eight ball if you don't have those extra clues to get you there. And unfortunately, what we saw over a number of years is calls that didn't particularly go that well, that really could have gone better with just a little bit of extra information or a little bit of extra instruction on what to do for those kiddos. So STARS stands for Special Needs Tracking Awareness and Response System. It was a system that was designed for EMS. It was actually initially created by EMS to take care of the most medically complex and fragile kids that are living in our community from the first responder viewpoint.
Children's hospitals have recognized the difficulties with trying to find the best way to handle these complex situations in the community. And I haven't seen a program that really addresses this problem as well as ours does. And I think the reason for that is because it grew not from the children's hospital, it grew from the community, it grew from the paramedics, and it grew from the families. What we're providing, I think, is an answer that's a little different than what's been done in the past, and I think has a chance to be really, really successful.
The STARS program helps with creating emergency care plans for them once they leave the hospital. These emergency care plans can be accessed by the emergency personnel that may need to know more about that kid in that situation. Referrals get evaluated by our team, make sure that they qualify for the program. Once they qualify, we have already gotten a HIPAA waiver or consent from the families in order to enroll them into the program. I will go in and read about their diagnosis and their care plan for within the hospital and put it into our care plan to make it tailored towards emergency responders and for emergency department staff as well. So once I have created the plan, we send it out through our 2 approving doctors. Once they approve it, it goes to the local EMS medical director, and they have to approve it to ensure that those can be actually performed by the emergency responders in that area. Once all our kids are in the system, we have behind the scenes tracking where all the kids live, a map of how many kids are in this area or that area, demographics, if the kid needs special equipment, if they're power dependent. So if there was some kind of emergency, a tornado or disaster, we could pull that information and help with relief for that area.
Centralized plans that the emergency department can access and the dispatch agency can access and the EMS providers can access, and quite frankly our providers here in our tertiary EDs can access all the protections, all the encryptions. They're all kept very safe and PHI accessible. Whenever an agency signs on board with us, we work with our EMS agencies to what setup works best for them. The main point is to have the EMS providers able to get into the system at the time of the emergency, and they will log into the website that houses all of the STARS plans. We want them to have access to all of them because you never know who might be in your district that day. They can initially just see the ones affiliated with their district, but they have an option to turn it to where they can see all of those STARS plans. And then they will click on the plan, and that will open this emergency care plan with the kid's name, their basic vital signs, their anticipated emergencies, their baseline presentation, all of the elements that we think are important so that we can get them a good outcome on that emergency call.
Every STARS patient has an individual unique number. They provide that number to the dispatch agency, and then the dispatch agency, when they dispatch an ambulance to that address, they can then send the STARS forms to the paramedics who are responding. So on their way there, they can review that form and have a much better idea of things that they may need to be dealing with when they get there.
The goal is to have the EMS provider already know that this kid lives in their community prior to the emergency. So when we make that plan live, their district gets an email. It says, hey, you have a new kid here. So we want them to already have awareness that they have a patient that they need to know about in their district. When that EMS provider gets the emergency call and they're responding to the house, hopefully they already know about the patient. We want them to be able to access the plan ahead of time. So whether that looks like them being able to just log into the website and access the plan, whether that looks like them being able to receive a text message with the plan from their dispatch agency. We're always trying to improve the ways that they get to the information. We receive, lots of reports back that it did help. It helped just to know what to do. Sometimes the specific instructions helped get through the emergency. Just giving them that confidence of, I understand this a little bit better has really paid massive dividends. We want to write good plans and we want to have those available in emergencies, but you can write the best words on a sheet of paper. If the care providers don't understand what that means or what to do about it, you're still not going to get that good outcome that you want. And that's why we think it's so important to go train on these low frequency, high acuity topics. Anybody who potentially could be taking care of this kid in an emergency, we want to make sure we're getting that knowledge out there into the world.
When we go on location, we bring all of our kits, tools, small baby mannequins, and devices that we can use to train hands-on. It gives them more of a feel of what to expect on those smaller patients, and so they are better prepared to care for them in the emergency.
And we encourage the medics to meet the families and even go to the houses. We've had some amazing interactions between the medics and the families. We always say you can't know what's normal unless you've seen it. So we need these guys to see these kids when they're fine, when they're healthy. That way they'll be able to tell if they're not healthy.
The STARS program has expanded a lot. We have kids from Springfield, Missouri to Springfield, Illinois, and all in between. And we service about 1,600 patients within the STARS program in Illinois and Missouri. We take care of a lot of kids.
We really worked hard to be able to expand STARS to make it scalable so that it can grow and work in other locations. Our partner in Florida has used the system well. We're so proud of them. They use it on an everyday emergency basis, and then they've also had some significant successes in disaster preparedness and disaster utilization with the hurricanes, using it as a tool and a resource to help find and follow those families throughout a disaster situation. So we want to improve that connection between all of this amazing care that's being done within the children's hospitals. How do we extend that care and that safety beyond the hospital's four walls? We want this to be a resource for families and for children's hospitals to work together to improve outcomes for this community. We're happy to talk with anyone from around the U.S. We've had lots of discussions with other hospitals about how we could potentially implement in their area, and there's some more information on our website as well to make that connection.